It's time for another new Kansas City Spotlight. Here's your host, Belinda Post.
Prostate cancer kills thousands of men each year, affecting 1 in 8. Yet over half of men over 40 have not been screened for prostate cancer. Here to explain how a simple blood test could save lives is Dr. Philip Koo and Gina Carithers from the Prostate Cancer Foundation.
Prostate cancer awareness is important because we have noticed recently a trend of increasingly men are being diagnosed with advanced disease, more and more men. And this disease is highly treatable when caught early. So it is a simple blood test. And when men have this blood test, it reveals whether or not they in fact have this disease. So we're recommending that rather than not having screening, get screened with your annual physical, and therefore you have a highly treatable 99% cure rate.
What are the biggest misconceptions when it comes to prostate cancer?
One of the misconceptions that men have is around the testing, and I think our survey shows that, and I think a lot of times men don't realize it's just a blood test, and there is something called a digital rectal exam that's, is often sort of discussed, but that's not really part of screening. And I think men need to realize it's very straightforward. You go in, the PSA test is ordered, you take a small sample of blood, it's sent to the lab, and then you get your results. So just a blood test.
What's actually involved in a screening today?
Today, the screening is literally a simple blood test. So we encourage men and the women in men's lives to have them go for their annual physical and to simply have this blood test ordered as a part of that overall exam of your overall health. And so it's a simple blood test. We recommend men begin having this blood test at the age of 45, unless they're at higher risk for prostate cancer. And those we define in high risk are men of African American descent or men who have cancer in their family. And therefore, they should begin being screened at the age of 40. So generally, it's age 45, 40 if you're at high risk, and for every man, this is a simple blood test.
What are resources for people and caregivers?
Patients really need to be empowered and knowledgeable and educated about this topic. And the best way to do that is to learn and read. And PCF.org has wonderful content, written content, video content that will provide up to the latest and greatest information on how best to manage your prostate health and prostate cancer.
This Kansas City Spotlight has been paid for by the Prostate Cancer Foundation.